continuing our Local Heroes series, where we've been fortunate to visit with a number of people throughout our community who are doing things that benefit so many of us in many, many different ways, especially during this pandemic that has really disrupted a lot of our lives. So today, we're fortunate to have Shanti Meyer, who's with Stride Community Health Systems, joining us. She's the medical director for Stride. And we want to welcome you, Shanti, and tell us a little bit about yourself and what you do at Stride, and talk about Stride for a second so that the people who are viewing this video have a little more information about you guys.
Absolutely. Thank you so much, Congressman. I'm so happy to be here with you today. So as you stated, my name is Shanti Meyer. I'm a nurse midwife and I have a PhD. I'm the medical director at Stride Community Health Center, and we're a federally qualified health center. And we serve all patients regardless of insurance status or residency status with primary care, which includes obstetrics, pediatrics, family practice. We also have a dental component and behavioral health. And we have care management, patient navigation. We really serve to be able to meet the needs of everyone and anybody for their primary care, dental, and behavioral health needs. And we have clinics all over surrounding the Denver metro area, and many of them are in your county in Jefferson County. So our mission really is to be able to serve and give quality health care to.
So how is that center going? And then I want to talk to you about the response that you all have made with respect to COVID-19.
Yeah, thank you. So our Wheat Ridge location on 29th and Wadsworth is just absolutely bustling. It's our second largest clinic overall that we have, and we have everything there. We've got, all of the services that I mentioned before: behavioral health, dental, family practice, pediatric and obstetric services there. In addition, we have a convenient care for people who have more urgent needs. And we also have a pharmacy that you can pick up. And one of the things that we've changed with this pandemic, I know we're going to get to that in a moment, is we have moved our pharmacy so that people can just drive up and get curbside pickup so that they don't have to come into the clinic to pick up those prescriptions.
Well, let's talk about what Stride's been doing since we've had to face the corona. I know Governor Polis was at the Wheat Ridge site, I think, within the last few days. And
he was.
So tell us what you guys have been doing, because you really have stepped up for our community. I want to thank you for that.
Thank you. Well, you're very welcome. It felt like a very easy decision and one that we didn't even have to think about. So we very quickly in March recognized that we, as a leader in the community health center field and just healthcare in general in Colorado, really wanted to step up and be able to meet the needs of our communities. And that really absolutely included testing. So we very quickly in the middle of March created a drive-through system, and one of our locations was up and running and continues to run today at our 29th and Wadsworth location. So, and then in April, we added on a serology antibody testing, IgG, in addition to our swab tests to determine whether somebody has the active COVID symptoms and virus. In addition to that, we've also opened a special pod at our Wheat Ridge site for people who are identified as COVID positive, so that they don't need to go into the hospital unless they really need to. So it allows us to still be able to meet the needs of our COVID positive patients who really need that in-person assessment but aren't quite needing to go to the hospital yet. In addition, we also very, very quickly shifted our focus from pretty much completely in-person visits to be able to do telehealth visits. And so almost overnight, we really made the decision that we wanted to keep our healthy patients healthy. And that meant at the beginning of the pandemic that they needed to be at home, but we still recognized that we wanted to reach out to them and make sure that they had their health care, both physical and behavioral needs met. And so we were able to very quickly institute telehealth to be able to outreach and do wellness visits over the phone, acute visits over the phone, have our behavioral health providers check in with them as well. And the other thing that I'm really proud of is we're also partnering with the homeless community in Jefferson County. And so we're also meeting the medical needs via telehealth for people who are homeless or near homeless who are staying in a respite hotel because they are COVID positive. And so again, it just really fit so easily into our mission and vision to be able to not only serve the needs of currently established patients, but also members of the community who really were needing to get tested for their safety and everybody else's safety around them.